Good morning, everybody, and welcome, Wakefield, to our weekly COVID-19 update. On us, we have members of the school department, Superintendent Lyons. We have our health director, Ruth Clay. I do know that our emergency management director, Tom Walsh, will be joining us. We have our communications director. Oh, he is here. Okay, couldn't see him. Jen McDonald. Let me see if I make sure I didn't miss anybody who's here. I know we have members of the public here, and we all are thrilled to have you here. And thank you for joining us, and thank you for doing what you guys do every day to keep Wakefield safe, or as safe as we can, given what's going on. I thought we would show, like we start every week, where we are in the state's COVID-19 dashboard. Ryan, can you put that up for me, please?
Mr. Mayor, would that be the map or the?
No, the chart first. My chart, the red chart. Nope, not that one. The one that shows the different communities in red. But okay, I'll talk from this one now. In any event, since Christmas, we have seen an uptick of cases in Wakefield, and I'm sure that Ruth and Tom will talk about that. And really, since New Year's Eve, since Christmas Eve, we've seen, to be perfectly honest, a couple of weeks where I think, despite the pleas and that we've done, is that, you know what, a lot of people did meet, and I get it. There's fatigue out there, COVID fatigue, and this has been shown, and our cases have upped. So we're looking at of the tests we've done, an 8.5% positivity rate over the last 2 weeks, which is not unlike many other communities. In fact, it is consistent with a number of communities. And you can see from the total case count here where that curve is steepening as we look forward. But unfortunately, we are not alone. Ryan, can you show the map, the red map? And I say it's red because it's mainly red. So you can see where we are, most of our surrounding communities are all in the red. And I think that, again, this is the highest, it seems to be the highest number of red communities every week when this comes out. And hopefully we've gotten past the last couple of weeks, and hopefully we'll be on a downward trend. Hopefully people are paying attention and trying to stay, you know, in a small group or what have you. Again, the greatest defense we have is wearing this mask whenever you're out in public. And anecdotally, I'm seeing most people, 99%, even when they're walking down, you know, out in front of my office here on Main Street, wearing the mask. So unfortunately, we've seen a lot. I'll throw it over to Ruth right now. I don't believe there's any one super spreader that we can look to. It's more of, you know, a combination of someone gets it in the household, and then all of a sudden, you know, the spouse gets it, the kids get it, and all of a sudden we've got 4 or 5, you know, people in the same household. So Ruth, why don't you jump in and tell me if that's kind of what you're seeing?
Yes, unfortunately, our numbers are skyrocketing, quite frankly. I can't give you a reason why there aren't any super spreaders. If you look at clusters statewide on the state's data dashboard, you'll see that households are by far the most number of cases and the most number of clusters. So I know I said this last week, and I guess I just have to say the same thing, that we're not in a good space. We're just not in a good space, and there aren't, I don't have an explanation about why our numbers are high, but our numbers are high, very high.
Okay. Before we talk about some of the good stuff, I'll go to Tom. Do you have any words of you want to add regarding the numbers? And then we'll go to Doug, and then we'll talk about part of the solution coming forward. Tom, did you have anything you want to add?
Not really. I just echo what Ruth said. It just looks like we're dealing with households, and you know, we've still been asking everybody to just deal with their own household and don't go forward. But it's hard, and then people are still going to, I don't know what people are doing once they leave their house, but maybe they're not being as safe as they could be. And like you said, please, social distance and wear a mask. And that's all I have at this point.
Okay, thank you. Doug, you want to give us a state of the schools?
Certainly. Thank you, Steve. So Ruth is spot on. The numbers are up. We had at the beginning of the week, our number of positive cases increased. We sent out a correspondence just updating the community on Tuesday morning. We sent out another letter this morning. Total number of cases this week, we have 25 students and 6 staff members. And so that's a total number of new positive cases this week to 31. We also have 255 personnel or students in quarantine and 20 staff members in quarantine. And we've changed the data tables or information that we're sharing with the public. Like we break out positive cases by school, we're also breaking out quarantine numbers by school. And so that information is further disaggregated by our nurses into 5 categories, right? Our nurses look at the number of students in quarantine that are directed by the Board of Health, who's in quarantine because of travel, how many students are in quarantine because as a precautionary measure or family choice, how many people in quarantine due to a sick family member, and who is staying out of school because someone in their home, it might be them, has COVID-like symptoms. So our quarantine numbers are 255 and 20, and that's really a prompt. That doesn't tell the whole story. Only 145 of those in quarantine are directed by the Board of Health, okay? And with this expanded, more detailed information, it kind of gives us some insight into decision-making and behavior by families. And we think that it's really representative of positive decision-making and behaviors. And kind of debriefing with our school nurses that we meet with every week, and with the Board of Health that we talk to almost on a daily basis. And I talk with Ruth very regularly. We're feeling like the number of close contacts that we're seeing in school is very low. Looks like the traces that we can trace back to school during contact tracing is almost non-existent, if not zero, right? And so because of those reasons, and because of, it looks like a lot of our positive cases are coming from students and staff members that are out on quarantine, we feel like we can continue in our hybrid schedule next week. So that's the plan right now. If anything changes over the weekend, we will certainly reach out to the community and let everyone know about changes. I also want to, again, I did this last week. I feel like I can't, thank him enough. I want to thank Tom Walsh, Ruth, and Steve for helping us get testing up and running. We test faculty and staff on Sunday morning. We tested again this past Sunday. We tested 118 faculty and staff. We had 4 positive cases. And we are also testing this coming Sunday, but we wouldn't be able to open schools without this information or without the service that we provide for faculty and staff right now. So thank you very much. We're also working with Ruth Clay and the Board of Health to figure out steps moving forward if we can kind of widen testing to include pool testing. But at this point, I think we have more questions that we're working on than we have answers, and we'll have more to report next week. But thank you.
Great, thank you. Again, testing is very important, and obviously social distancing is very important. But let's start to talk about some of the solutions. There's a lot of information out there on the internet, on TV, and it talks about testing. And I will tell you that phase 1 of the testing, of the vaccination, a lot about the vaccination. So sick of talking about testing. I want to talk about vaccination now. Is going on, and I would say that by the end of this weekend, if I'm not overstating, probably every first responder in Wakefield that wanted to get the vaccine will have received the vaccine, the first dose. And I see Ruth putting her head up and down, which means that that was correct. I said something correct today, Ruth. Thank you for backing me up. And why don't you talk about the whole vaccine protocol and what is going to be hopefully coming out shortly, and kind of the exciting steps that we're taking here in Wakefield. So
Sure.
I'll turn it over to you, Ruth, and then back to Tom.
Thank you. So yes, our first responders have been offered 3 days of vaccination clinics. That was Thursday, Friday, and tomorrow. So Thursday was stood up by Medford at their police department. Today is at Malden at their police department. Tomorrow is in Melrose at Memorial Hall. People have registered, and they will receive their first vaccination. So it's voluntary. Anybody who wants it will get it. And we also have some of the Wakefield firefighters who are EMTs or paramedics, who are also helping to staff the clinic tomorrow. So it's very exciting. Actually, Tom Walsh got his vaccination on Tuesday, as did I, at our the Vaccinators pre-clinic. So that so it has officially started, and we're really excited about that. So yes, we have officially started vaccinating Wakefield, which puts a smile to my face. So if people go on to the state's website, that Jen's putting up, there's a new graphic. Looks like this. It's new, it's updated. And they also have, in addition to who's in which phase and which group. Yes, thank you. Love it. Much better than me holding it up to the screen. There is also this new graphic that says when people can start getting vaccinated. So we are given vaccine. We're not allowed to do clinics until these times. So the second week in January, which is beautifully says, we are here, says first responders and congregate care settings that already have a contract with the federal, I don't know what it stands for, but it's basically the, Federal Pharmacy Partnership Program. So those are group homes run by Department of Mental Health, a lot of state agencies, some of them are run by Elliott. We have surveyed all of our congregate homes. We don't have a jail or a homeless shelter. We do have sober homes. Our staff contacted all that we knew of yesterday, so we have an idea of how many are looking to be vaccinated by us. Quite frankly, there aren't that many. Most of them have already been taken care of. And then starting the first week in February are home-based healthcare workers. And I'm going to give Jen some information she can put online that will be very clear as to who falls into that category. So we are in the process of planning and deciding where and when we will be holding a clinic, at least one, the first week in February. It will be done in conjunction with our other communities, Medford, Malden, Melrose, Wakefield, Winchester, Stoneham. Those clinics at least will be done regionally, and we're still in the planning phases for after that. So keep watching our website. The information will be there as soon as we're completed planning. We quite frankly, we've been pretty focused this week on the first responders. So next week, we have started discussions about those other groups, and we'll hopefully have some specific dates, times, and information by the end of next week for the rest of phase 1. And we have not, and then we will start the planning for phase 2. So when it comes to large groups of populations, we'll be using mass media like Reverse 911, the website, these opportunities. We'll use Jen will be using every opportunity she has to get the word out. We get a lot of calls from people, is it my turn? When can I get vaccinated? And again, we're going in order because we are required to go in order. And the smaller groups we're contacting directly. But once we get to the end of phase 1 and the beginning of phase 2, because those are much larger groups, that will be out publicly so everybody knows. We want to get the word out as quickly to as many people as possible. Just give us a little bit of time to work out the details and it'll be out. Tom and I and Steve are meeting next week to look at a particular site. And as I said, we're working really hard to get that information up and ready for everybody.
Yeah, I think if I can jump in, what is very important for the public to realize is that the town, we did not even really know whether we could if we could do vaccinations locally until I think a week ago. When that came out, we heard that, and to Ruth's credit and to Tom's credit, we decided we were going to jump on and take care of Wakefield when we got to this, more larger mass distribution. That's point 1. Point 2 is that Ruth, Tom, myself, the town council, the Board of Health, the school department, the superintendent, we do not set the rules of who gets vaccinated when. That is given to us. We are told that this group can be done now, this group can be done later. So I have a lot of people that call me personally, and believe me, I feel for every one of you. Why is this group getting vaccinated? Why is that group getting vaccinated? That's the rules. That's the rules we're going by. We're getting we're going to get the vaccines, and we need to do it in what the state via the CDC tells us what to do. So we can't change the groups. Okay, so just let's put that out there. Let's everyone understand that. You may disagree with what the groupings are. I may disagree with what the groupings are. Ruth and Tom may disagree with how the groupings are. But those are the groups. Those are the rules we got to go by. Tom, did you want to add anything? You usually have a much more folksy way of saying these things.
No, I did. I actually wanted to get back on the school thing. We've been doing the testing. I just want to say that in the past couple of weeks, the positivity rate that we've been getting on the schools has been about half of what the state average is. So that's good on our end for that thing. That's why I wanted to mention that. Also, I wanted to mention that I've had a few of our CERT members. The town implemented a program about 1.5 years ago for a civilian emergency response team. And they are all calling me now to volunteer. So I'll be putting some out today to our CERT members to be on deck for our future clinics. But no, I mean, we can only do whatever the state tells us we can do. So, I mean, I'm getting the same calls that the town administrator and everybody else and Ruth is getting. We're governed by what we have. So that's all I have.
Can I just jump in to follow up on what Tom was saying? We have a very community-minded population in Wakefield. And I know there are lots and lots of people who want to volunteer. And we're gonna ask you to volunteer. But we're not quite ready for that yet. So we will have somebody who's going to be coordinating the volunteers and asking for volunteers and organizing all that. But please just be patient, and the word will go out that we are looking for both healthcare volunteers and non-healthcare volunteers. Steve and Tom are both volunteering tomorrow at the first responder clinic. There's a lot of other jobs to do besides vaccinating. So when we are ready to get that part organized, we will absolutely let you know.
And yeah, we are very committed. We have a fabulous communications, I'm gonna say department, she's a department of one, who will get out this information in multiple ways that we will do it. You know, reverse 911, certainly on the town website, through the media and what have you. We will certainly get out the information. So we do appreciate everyone's patience here. It's very fluid, and it's very fluid for us too, because it changes almost daily. You know, so we're trying to stay ahead of the curve, and I am very proud that we are a community that is going to take this on and vaccinate the entire community. And think about it, we'll probably be doing, you know, 25,000 people that we will vaccinate through our health efforts here. Right now, that's 50,000 shots. So think about that. That's a double thing. So it's going to be quite an undertaking, but I have complete confidence in not only the community of Wakefield, but in our staff and our volunteers that will get this done. So that's my word. Does anybody else have anything to add here? Did I miss anything today? No?
There's links in the chat to sign up for the Code Red e-alert system, which is also used for other emergencies like boil water orders, parking bans. So if you're not signed up for that, you'll want to do that. That's how you get the text and email and phone call alert. There's also a link in here to sign up to receive all news and announcements, emergency and non-emergency, on our site. If you happen to be watching a recording, you can go to wakefield.ma.us, and it's the Get Town News button in the upper right will bring you to those two items as well.
Can I just, I'm just going to add a little addendum to what we're talking about, because our conversation has been very tech oriented in our communication efforts. And I just want to assure parts of the population that don't use computers or texting, things like that, that we will be also having non-computer, non-texting alternatives for communication and for signing up for clinics in different languages. So I know I'm kind of talking to a self-selecting audience, because all of you clearly are watching on your computers, but for your friends and relatives who may not be as techie as you are, don't worry, it'll all be done in multiple ways so that everybody will have the opportunity to sign up.
Yeah, exactly. And, you know, we're really going to focus on our more vulnerable populations that I've spoken to a lot of them on the phone that, you know, don't, like Ruth said, they're not computer savvy, but we're not going to leave anybody behind. We have a great Council of Aging, a great director there who has a great database, and we'll be doing a lot of outreach in that area too. So stay tuned. Anything else? Anybody? No? Well, thank you, everybody. Stay safe. It's a beautiful day today. Please take a walk this afternoon before the rain comes in. It's the best thing for you. Thank you, and stay safe, Wakefield.
Thank you.